I've decided to do the cycle ride because I, as a respiratory doctor, very much support the expansion of the ultra low emission zone, just because of the health benefits. Really, it's going to massively improve the health of millions of Londoners, and we're really lucky that it's happening. And as a respiratory doctor, seeing the patients that I see in my clinics, I can really see the benefits that that's going to bring. I see it in my clinic week in, week out. We know at a kind of big level that 4,000 Londoners die every year because of breathing our polluted air. And though I'm a respiratory doctor, I see lots of people with lung problems. It's really important to remember that there's not an organ in the body that air pollution doesn't affect. So literally from the brain to the placenta, so from cradle to grave, air pollution affects every single organ system we see. Particularly in my clinic, I see lots of people who live with asthma, lots of people who live with chronic obstructive pulmonary disease, lots of people who live with just upper airways inflammation, which affects their breathing. And it's really frustrating because, we can treat them, we can give them medicine, but all the while I know that it's because of the air they're breathing, and it shouldn't be like that. I can understand the backlash, and I think for individuals it might present a problem. However, we cannot wait any longer to clean up our air. So it's such a health emergency. We lose 4,000 Londoners every year prematurely because of air pollution. And just to put that into perspective, that's more than 10 Boeing 747s worth of people in London who die every year. So it's such an urgent thing to do, and I think there's no other reason really. It's a public health crisis, and we really need to act.